Hello, TBN family. I'm Dr. Steve Tillett. I'm a podiatric physician and surgeon in a practice in Portland, Oregon. I'm excited to be with you today. Welcome to Doctor to Doctor. Today we are going to talk about diabetes and how that affects feet. This is such an exciting time that we live in. What a blessed people we are to live when we live. In spite of the turmoil and the challenges and destruction that seems to be happening in the world around us, we're still a very blessed people. We have many things to be grateful for, and modern medicine, and thanks to the good Lord, has brought us things that keep us healthier and more active. As God's plan for you is to be healthy in all aspects of your life. As we read in 3 John 1, verse 2, it says, "Beloved, I wish above all things that thou mayest prosper and be in health, even as thy soul prospereth." I completely believe that as we work to keep our bodies healthy, control our diabetes or what other ailments we may have, that our soul will prosper, that we will be healthier physically, mentally, and spiritually, better to work to bless those around us and be closer to the Lord. So I'm excited to have this conversation with you about diabetes and what it can do to the feet. There's a few key things we think about with diabetes. Oftentimes people think of eyesight affected by diabetes, and that's a very important thing, and it can have a very negative impact on patients' lives. As a foot specialist, I would like to highlight two in particular systems that get affected, and that is the circulation and the nervous system. And let's talk about how those things interact with our overall health and how that diabetes causes problems with our feet because of that. So first of all, we think of normal diabetic control as being controlling our blood sugars. Well, that's so important. That's a key factor. Please follow with your primary care physician and do it often so that you can maintain good blood sugar control. Now, in spite of that, sometimes patients are diagnosed with diabetes and they already have some of these other conditions that have been caused by the diabetes, or in spite of good blood sugar control, they'll still have problems with the nerves, have nerve damage that is, until now, usually thought of as something that's irreversible. So we know that this is caused by blood sugars and circulation and how it gets to the nerves. But let's talk about what happens once that has occurred. So one of the tests that your podiatrist hopefully has done for you is a test with this funny little piece of, looks like fishing wire. It's a little short, but let's not fish with it. Okay, this fancy little test with this fishing wire, a very specific size of a monofilament wire, tests the ability to feel this exact amount of pressure. If you can no longer feel this monofilament wire, it means that you've dropped below this certain threshold where you become at risk of maybe a foreign object in your shoe, or even a callus that's on your foot actually becoming more of a foreign body. Because if a callus gets thick enough, it will rub and the pressure builds up, cause an open wound under the callus. That open wound becomes an infection. That infection gets deeper, gets to bone. We just don't have good treatments for that. Antibiotics don't treat bone infection well. That's what leads to the amputations. Big, ugly word, amputations. And makes me want to dispel one of the myths, and that is what I hear from patients frequently about, once you start whittling away on my foot, you're never going to stop. I don't want you touching my feet, even if I've got this problem. And that may preclude patients from going to see their foot surgeon when they have a problem with their feet. But the truth is, some of those amputations are not only eliminating infection, but they actually can be limb salvaging or even life-saving by getting rid of these infections that our body just can't fight off. So it's very important to be aware of that. Have a relationship with a foot specialist who can check your feet for those problems and hopefully prevent those problems before they get too bad. Other things that we do that are extremely important and that we want to consider in protecting our feet from these types of problems. Number one is we look at what is the environment of our feet, and that is special diabetic shoes. So I want to show with you what traditionally has been thought of as, oh, those ugly diabetic shoes. But these are pretty sexy. If you compare these to the old shoes, they've come a long way. So medicine's come a long way, so have the shoes. But there's special qualities that a diabetic shoe has. A deeper toe box here, wider forefoot, and then in spite of these fancy stitching lines, if we look inside this shoe, there are no seams. Now, a seam for a diabetic patient who can't feel it can rub a sore that they don't feel, and by the time they know that's there, they've got an infection. That's why these things are so important. Diabetic shoes have a special insole that is made of the only material that Medicare has recognized as certified to protect the diabetic foot. So that's why those things are so important. You know, it's important to protect other parts of our body, to use compression stockings to control the swelling in our feet that can break down the skin. And that's something to talk to your doctor about. I can't emphasize enough how important all of those things are. It's easy to ignore some of them because maybe those socks are just too hard to get on. If they are and you're not wearing your compression socks, talk to your doctor. Maybe you can try a lesser compression or a bigger sock, because if you can't get it on, it's not going to do you any good. So now let's talk about what we can do to help improve ourselves other than staying active and controlling our blood sugars. The advances in medicine have taught us many new things. Vitamin D, we've learned that it needs sunlight. So we've been told spend 20 minutes in the sun or exposure to sunlight so that vitamin D can be active. We've learned that 3 of the key components, vitamin B6, B12, and folic acid, are extremely important in nerve health. And we've known that for decades, but we've recently learned that if they can create the active form of those, we absorb them 7 times better. So the active forms of B12, B6, and folic acid can help the nerves by creating better circulation, giving them the nourishment that they need to get healthy. And I've seen actual sensation restored in patients by using these. What a glorious time we live in to be given these wonderful new advances to help us better be in the driver's seat, take control of our own health, and be healthier so that we can then serve the Lord and bless those around us. Thank you very much. Once again, I'm Dr. Steve Tillett. I'm a podiatric physician and surgeon here in Portland, Oregon. Thank you again.